Hello, this is Ron McCullough, consultant podiatric surgeon, and this brief video is just an overview on the subject of flat feet. So what is the definition of somebody who's flat-footed? Well, it's a little bit complex because on the one hand, one could simply just say it's a person with a flat arch or no arch or almost no arch. But some patients have a lot of collapse of their ankle and their arch drops down a lot, but they may still have an arch, but they're very much outside of their normal position. And we tend to refer to this as abnormal pronation. Conversely, you could have somebody with a low arch who actually has fairly good joint position, so they could have a low arch, but the abnormal pronation, which is the collapse of the arch and the ankle, is actually not as bad as it could be. So I'm sorry that it is more complex perhaps than we'd like it to be in terms of a definition, but it's important to appreciate really that flat feet can occur for all sorts of different reasons, and that some flat feet are pathological and cause a lot of problems and others don't. In some cases, joints can be fused, and this is called tarsal coalition. And in this instance, when the joints are abnormally fused, if you have a flat foot as a consequence of this, it can be far more serious. In other cases, the foot is flat because of extreme laxity of the joints, and we call this hypermobility. In some cases, it is just to do with the structure of the joints, and in some rare cases, it's so severe as to require surgical intervention. What causes flat feet? Well, on the whole, it is mainly a genetic predisposition. So the vast majority of patients who come to see us have flat feet because they've inherited them from their family, from previous generations. It can be caused by injury, of course. If you rupture a tendon or if you damage your foot badly, you can get it. And flat feet can also develop as a result of certain types of inflammatory conditions such as rheumatoid arthritis. But the vast majority of people that we see with flat feet, they're flat because of genetic reasons. How is it diagnosed? Well, it's probably quite obvious to see whether somebody's flat-footed, but the key is to diagnose what kind of flat foot it is. Is it a fixed fusion, an abnormal fusion of the joints? Is it to do with the neurology? Is it because the patient is double jointed and hypermobile? All of the different presentations will result in different ways of treating the flat-footedness, and it will also indicate how serious the flat-footedness will be. So one of the key objectives of the center is to actually diagnose the type of flat foot that the patient presents with. How do we treat it non-surgically? Well, of course, the majority of patients who present at our facility with flat feet will be treated conservatively. There are specialist shoes on the market called anti-pronation shoes and trainers, and we would recommend those for a start. But also we would, after gait analysis and in-depth examination, often produce good orthoses, which are specialist supports that go inside the shoe to alter the way that the foot functions. A bit like prescription glasses for your eyes, these are prescription insoles for your feet. In some cases, special splints are required to actually realign the foot, and one example of that would be something called a Ritchie brace. In some cases, we combine braces with orthoses. Obviously, in all cases, or in most cases, we would recommend strengthening and stretching, and we'd usually get our physiotherapist involved to deal with this. Sometimes manipulation is appropriate. But what about surgical management? Well, rarely is surgery required for flat-footedness, but it can occur. In some children, if they have severe restriction of their ankles and their Achilles tendons are extremely tight, and it looks like it's causing all sorts of different problems which need to be controlled, then sometimes surgery is appropriate. The surgery itself can also sometimes be necessary if a tendon snaps and ruptures, and as a result the foot completely collapses, and then we have to consider surgery to avoid the whole thing from becoming worse and causing greater postural conditions. So what type of surgery is there? Well, some simple surgeries involve putting an implant in the back of the foot in what's called the subtalar joint, and these are called sinus tarsi implants. In other cases, we have to do much more and cut through bones and refix them and fuse certain joints in order to provide the foot with the necessary support and architecture to be able to function in a less flat-footed way. And these operations are quite extensive. You're looking at surgery that can take a couple of hours to undertake, and the recovery from this type of operation can certainly be in the region of about 3 months. These are all operations that I have done in my career, and I'll be able to provide extensive advice as to what type of management is required in order to manage your specific flat-footedness. So what's the long-term prognosis? What's the long-term outlook? Most people do okay with flat feet. They're better off perhaps choosing certain sports over others and certain activities over others, but it's very rare for flat-footedness to cause really serious issues unless you have a very serious type of flat foot, and our center will of course be able to advise on that if you come to see us. So I hope this overview is useful, and we have dealt with flat feet for the last 30 years or so, and we have many investigative modalities including advanced ultrasound and of course our gait analysis facilities and lots of treatments to help you manage this condition.